Hey everyone, this week we're talking about depression in children and adolescents. And question number one, what are common signs and symptoms in children and adolescents experiencing depression? According to WebMD, some of the signs and symptoms are anger, sadness, and hopelessness, increased sensitivity to rejection, changes in their appetite or sleep habits, verbal outbursts, and lots of crying, difficulty concentrating, low energy levels, physical complaints that don't respond to any kind of treatments, a decreased ability to function in social situations, feelings of worthlessness and guilt, impaired thinking and concentration, and of course the thoughts of death and suicide. What kind of stinks is that a lot of these can be attributed to lots of different things. So I can see how it would be kind of hard, actually very hard to pinpoint this as depression, especially in children who can't vocalize exactly what they're thinking or feeling. Number two, explain the pathophysiological mechanisms that contribute to these assessment findings. Our textbook states that the causes and exact etiology for depression are not known, and there is still a lot of research that needs to be done on the topic of depression. However, it does say, our textbook does say that depression is known to be a very complex condition and that it can have roots and any number and combination of genetic factors, biological factors, and environmental factors. The biological causes are associated with decreased levels of neurotransmitters such as norepinephrine and serotonin levels in the limbic system. It's also pretty well known that there is a genetic component that exists with depression. Our textbook says that depression is 1.5 to 3 times more likely in someone who has a first-degree relative, like a mom, dad, sister, brother, with depression. And it's also pretty well known that stressful and traumatic events, divorce, moving can sometimes be, I'm thinking about things for kids, are all environmental factors that can lead to depression, especially in children whose emotional maturity level and coping skills are not fully developed and stuff yet. So number three, explain the pharmacological action of drugs commonly used in the management of depression in children and adolescents. The drug that I found most often was Prozac, the fluoxetine, which is an SSRI. Our textbook states it is the only SSRI approved for the treatment of pediatric depression. It works by blocking the uptake of serotonin at the neuronal presynaptic membrane. However, it excludes the norepinephrine, which is the another neurotransmitter, and just blocks the serotonin. Depression is a very real condition, does not discriminate, affects people across the board, and it affects everybody differently. Like I said, a lot of research still needs to be done for us to really fully be able to understand and then most efficiently treat this disease.